Hey, welcome back to ChooseHelp.com. I'm Jim LaPierre. Today I want to talk about marijuana because it's come under a great deal of scrutiny. We have more research on it today than we have ever had. And with legalization, medically and in many states recreationally, it's certainly created quite a buzz amongst the addiction recovery community, amongst addiction recovery professionals. It's become increasingly controversial, and so the things that are controversial are quite often the things that I want to talk about. So, one of the things that I do feel is important to appreciate about marijuana use is that research is consistently showing the impact on the developing adolescent brain is more negative than we had previously thought. And so I most certainly don't condone marijuana use in adolescence, but I certainly do understand it. As a teenager, I used marijuana to fit in, to be cool, because I was curious about what it was like to be high, and because I was medicating anxiety and depression. Now, the marijuana that I used in my adolescence is, of course, radically different than marijuana that's available today. I sometimes joke that the folks who are out there developing different strains and creating marijuana that is purple and has crystals growing on it, I want to get those guys curing cancer because I'm pretty sure they could get it done in a very short amount of time. In all seriousness, I know folks who grow, and I know that it's a passion, it's something they love doing. I understand that there are two main strains of marijuana, but within those two strains are dozens or even hundreds of different subtypes that have different effects. And so for some folks, using marijuana is medicating self. Very commonly, anxiety and especially with PTSD. For other folks, it is something that they use to improve their appetite. So getting enough nutrition, having a sufficient appetite on their own is not working, and so that for many is a positive use of particular strains. Um, the question still somehow exists: is marijuana a gateway drug? Which I think is completely insane. We know, and research consistently shows, that there are many other substances that a young person uses before they experiment with marijuana. And typically, alcohol and nicotine are both used before a young person experiments with marijuana. And so, if I was going to point towards a particular gateway drug, undeniably it's alcohol. I am uh, out of the box when it comes to marijuana use. Most of the folks that I've provided treatment to are in recovery from both addiction and from PTSD. They may or may not meet 100% of the criteria for a diagnosis of post traumatic stress disorder, but they undeniably have experienced and survived a lot of past abuse or assaults. And so living with PTSD is exhausting, it's debilitating, it makes it extraordinarily hard to have a decent quality of life and to focus on what's really important to you. So in those cases, I do see a huge benefit from limited use of marijuana. And what I also notice is that overall it is a much safer substance to be using than one of the go-tos for prescribing clinicians of treating anxiety are often handing out benzodiazepines, which we know are highly addictive and easily abused. So medications like Klonopin and Ativan and Valium and particularly Xanax, which has been shown to impair a person's ability to develop and store memory. So I know it's not that I want to be a proponent either way. To me, the make or break point about using marijuana is this. If smoking pot or vaping pot or using edibles or however you experiment with marijuana then makes you want to drink or then makes you want to use your substance of choice, then I would say obviously it's unsafe. If you can use marijuana in moderation, if you are medicating a medical or a psychiatric condition, then I think that's great. But I would say you're going to need some accountability with that. Because if you have an addictive brain like mine, then your brain's going to tell you that you need more and more and more of marijuana. It's going to tell you that you're in more pain than you actually are. It's going to tell you that your symptoms are worse than they actually are, because that's what an addictive brain does. The disease of addiction will hijack any thought process, any substance that I'm using, including food. Having an addictive personality means I don't like to do anything in moderation, and so I've been known to overeat, which is very common for me. But in the grand scheme of things, not a huge health problem, but it's an excellent example of how a moderate amount or a healthy amount doesn't feel like it's nearly enough to me. So if I'm not careful, I could do the same thing with something like marijuana. Which is actually all the more amusing to me. It's a line from Dave Chappelle. Do I look like the kind of person that would smoke marijuana? Yes, yes I do. But I have found that I don't enjoy it. And I didn't enjoy so much the old school marijuana for my youth, and I certainly don't enjoy the things that we've come out with in recent years. I don't like a substance that slows me down, makes me sleepy, makes me really, really hungry, but feel like I can't get up to go to the refrigerator to get anything. So, fortunately, completely clean and sober long term in my life, and no interest in it. So, I understand that it's controversial. I understand that it's safe for some people, and my biggest piece of advice to folks is make sure you have plenty of accountability in every part of your life. Because the real downside to marijuana, it tends to reduce our productivity, it tends to dull our thinking, and I don't see that as a huge problem. I mean, I think the worst possible scenario if you use a lot of marijuana is maybe you end up living in your mom's basement, maybe you play way too much Xbox, maybe you deliver pizza for a living. I don't know. I don't want to judge that. I know it's not congruent with what I want, with what my goals are, so that's not going to be part of my life. But if living with a neurological condition, a chronic pain physiological condition, or a psychiatric condition, like every form of anxiety, is what's happening for you, then you're hearing from an addictions and trauma counselor that yes, I think that can be safely done. And I encourage you to talk with people who have expertise about particular strains. I encourage you to talk to your medical providers, and most of all, I encourage you to think about moderation, because there's a world of difference between self-medicating, getting high, and getting stoned. So please do what's healthy for you. Please keep making investments in every other form of your recovery, and please write to me, Jim@choosehelp.com. Would love to get your questions answered. Would love to hear about topics that you'd love covered. Please visit our site, sobernow.com, which has a home study program for overcoming addiction, or for those of us who have loved ones in active addiction. And those are some great resources for you. Thanks. Have a great day.